Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our discussions with the second segment, we'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment is my co-host, Dr. Tess Sanchez.
Hi. Hi again.
Yes. Unfortunately, we don't have Father Jerry Manlangit and Attorney Sarah Sagitan today.
Naglalako ata.
Yes, they're on break,
Anyway.
on the break right now. Okay.
Okay.
Anyway, so, Doctora, in the first segment, we talked about Doctora Lainez's practice as a dermatologist. Okay? But off the air, I heard something about her extracurricular activities.
Yeah, and we're sometimes together there. First of all, we love to do ballroom dancing. And sino ba yung lagi natin kasama ko minsan sa Soler and everywhere? Si Senator Rene Sagiza. You know, sabi ni Senator Rene, yung gusto niya mag-ballroom in order to forget also as a business side, no, the professional and everything, the problems associated with his profession, no? Pero, pag nakita kami, naalala naman niya na pasyente rin siya. Na-depressed din.
Okay, so he is a patient of yours.
Well, sometimes, at one time or another. Yeah. Hindi sa OB, ha? Sa kanya, sa derma.
In dermatology.
Yes.
Okay.
And with my husband, who's also an internist, cardiologist.
So aside from ballroom dancing, what else do you involve yourself with?
I involved myself with, giving back sa Makati Medical Society. We have our medical missions. Usually about every 2 weeks, usually on a Sunday. And then we go
Every
to
2
different
weeks?
places like,
Okay, so
like
what we have on screen right now, that's
yes.
medical mission.
So we go to different places in Makati and also different parts of the Philippines.
Madalas yan, ha? Every
Yes,
2 weeks is quite
every
frequent,
2
no?
weeks.
Usually once a
Usually
month,
it's,
once a semester.
Yeah.
Yeah.
Usually do it at 9 to 12. And then we disband at 1 o'clock. So we can go back to our families. We can have our Sundays
Usually
together
Sunday
with the
yan,
family.
no? Sunday.
On Sundays.
It's really a practice, sacrifice in a way.
On
Yes.
Sundays.
Yeah.
Okay, so
Aside from that, I do some paintings.
so
Yeah.
Because
you're a
I'm
painter.
yes, I'm actually a frustrated artist.
Not really. I saw some of your works and they're quite
Yeah.
impressive.
Yeah,
Okay,
that
so
is
what do
Is
we
that your
have on
class?
screen right
We
Is
now?
that
had
your
a-
class? Oh, look
for
at that.
Philippine Dermatological Society, we had a painting contest. This is a watercolor gomamela.
You did that?
Yes, I did
Wow,
that.
how nice. Wow, wow, wow.
And then this is
Oh,
entitled
derma.
Red Toes.
Oh, those are
Is that due to
toes.
disease or just ano? Red paint.
Red
Yeah.
paint, toes.
This is before and after of
Of what?
a patient. So in
one
the
of your
beginning, she had
patients.
curly hair. Now she had the straight hair. This is
beauty,
a
huh?
painting of my friend, Dr. May Season. I did
Oh,
this
really?
for her,
Ah, yeah, no.
when she was younger.
May Season used to be
younger.
our guest
Yeah, she
before
was-
and
she
talked
was your
on
guest also
endocrine
before.
diabetes.
And this is a nude painting.
Wow.
Uh,
Nice, nice.
yeah, but it's not, I
Also-
think it's
But not
yet-
live, huh?
Not
That is
live.
not a
No,
live,
no, no,
just
no.
from your imagination.
Yeah, but the lower part of the body, I had to tell my daughter to pose. So the lower part is
Can you go back to that,
from the
that
thighs.
picture? Can we go back
From
to
the
that
thighs to the
picture?
legs.
Yung kanina,
Yeah.
yung nude.
This
Ayun
is
na.
a Picasso that I painted on a bag.
Okay,
Oh,
canvas
wow.
bag.
Yeah.
Oh, you see
Na-
how ingenious?
Yeah.
You know, no, she should have probably been a painter muna.
Yeah.
Yes, that was my first dream actually. I wanted to be an artist, performing arts. I wanted to be a pianist.
Really? So you know how to play the
Yeah, I
piano
played
pa
the
rin?
piano.
Wow, my gosh.
And,
Multi-talented.
And I wanted to be a painter, but my mother said there's no future in the arts.
In the,
Yeah,
before,
for your
yeah.
Dermatologist.
Para may bread and butter
Yeah.
muna.
Okay.
Yeah, no,
But
how
I
nice,
suppose you can still, practice your aesthetic sense in your
Ah,
specialty.
yes, that's right.
Kaya
That's-
derma pa
that's why
naman,
dermatology,
taga-beautify ng tao.
Yeah.
Yeah.
When the patient comes to me, I already know what are the things. Because the patient comes to you with some things in mind, like, I want this like that, I want it like this. But sometimes I discourage them, like for example, if you want to remove all the wrinkles in your face and you're already 60 and above, I think it's not practical. You look like a mask. No? So these are the things that you should consider also.
Do you use laser also for removing wrinkles?
Ah, yes, fine wrinkles, and even if it's coarse wrinkles, several treatments talaga. But if it's fine, can be 1 or 2 treatments, wala na yung fine wrinkles.
Really?
And how long does it take to finish one treatment?
Madali lang. It's usually
an hour,
less
30
than an
minutes?
hour, less than
Less than an
30
hour.
minutes, really. If you
Kasi you
want
have
to
to do-
treat
you
a
have to
full
limit
face,
it,
if
no?
you have one laser resurfacing, which means you want to change the surface of the skin,
Okay.
30 minutes would be good enough in an
Half an
average
hour.
size face.
And then you have to come back how many times, more or less?
If you want, you can continue. But if you are, that should be every month, no? More or less every month.
For
once
how
a month,
long?
For 6 treatments. Now, if you are economizing, you just want one treatment, you can continue with topicals. The topicals are not very, very, very modern.
Effective then, no?
There's so
Very-
many topical preparations now that can help you treat the wrinkles, the fine wrinkles, the coarse wrinkles. And of course, let's not forget the fillers and the and Botox.
You have to combine all of this in order to look
botulinum toxin.
short of surgery, no? For plastic
Yeah.
surgery for the
Yeah.
face.
So how long do these effects last?
For the fillers, usually within a year.
A year.
There are those that are more permanent, up to 5 years, like that. But we usually prefer that it's at least 1 year only, because if you want to revise and you want to see the effects, the initial effects, it's nice that you want to change it.
And such therapies
Botox is
yes,
you can do it
Botox.
twice a year. Twice a year.
Twice a year.
Yeah.
And
Maganda
these,
naman.
these therapies, are they more cost effective compared to surgery?
Yeah, I
Mas
think
cheaper
so.
ba
Though,
yan
especially
kesa
those who
surgery?
are afraid of surgery. Actually,
Yeah,
if you
there
want
are people who
facelifting, these things can be done already by topicals, by injections.
At saka
many
parang
things.
reversible because if it's in
Yes.
surgery, you really get plastered, no? Sometimes
Yeah.
you lack the eyes expression, especially around the eyes, no?
Yeah, I see
So
a lot
parang
of
feeling mo-
complications
So
of
very unnatural.
also-
yeah, of bleps. Yeah, it happened to my own family.
Oh,
One
what
of
happened?
The
What
members of my
happened?
family had a bleb, and then there are some complications, and more than 1 year, his face still
This, worse than before.
swollen.
Swollen.
Really?
Erythematous and swollen, so much so that I thought he had the cellulitis in the face.
Yung pala, it's because of
Yeah.
the surgery, the trauma of surgery.
Trauma of surgery.
I
Okay, so
see.
laser and all these alternative therapies are safer.
Much safer. yeah.
Safer.
And actually, with laser, if you ask me, is it can it cause cancer? No, no. It's non-ionizing. The laser light is non-ionizing. As of now, there is no cancer that has been directly attributed
To
laser.
laser.
treatment.
But is it cost effective, cheaper than surgery or not? Or it
Actually,
depends?
here, if we do it, our treatment is much cheaper than the U.S. US
for
price,
laser.
yeah.
But what about for the
Compared to
surgery, if
surgery.
you choose?
Even that's why
between?
you
Much,
see
much
balikbayans
cheaper.
having their procedures done here.
Yeah, that's I know, yeah. And they like the way we do it, no?
Yes.
It's really Asian. Baka paglabas mo sa States, ano ka na, Caucasian. Ibang-iba na.
Well, I suppose there's a very huge demand for such services these days, especially for the aesthetical applications.
Yes, because I think number one is economic improvement of most of the Filipinos, because there are a lot of overseas contract workers who come here
And
from
they can
Japan,
afford.
from Dubai.
Yes.
When they come here, they have lots of cash, and they want to improve their appearance.
Right.
It's just that there's this, I mean, I have a concern about, the proliferation of so-called derma clinics all over the country. So how would one know if these clinics are credible or reputable?
Probably they can first ask who are the doctors, the roster of the doctors that are practicing in that clinic. They should be board certified, Philippine Dermatological Society certified.
Certified by the Philippine Dermatological
Yeah.
Society.
Yes, because that's specialty society that is that is accepted by the Philippine College of Physicians.
Because they undergo a series of examinations,
Yes,
that's
and
correct?
we go
And,
specialty board exams, and then of course residency, residency
And
training.
the development of skill to do
Yes,
these things.
yeah. But what I mean is, if these complications of laser treatment, the Botox and fillers can happen in a doctor, in a dermatologist, how much more in the hands of non-dermatologists and improperly trained operators.
Right, right.
Yes.
And you know, once you fix it, sometimes it's irreversible, no?
Yeah.
They do develop keloid sometimes, right?
Yes.
And
The irony of it
in
is
your face,
they come to us, first they come to these clinics outside, and once they get the complications, they come to us.
to have that remedy.
Treatment
Ay,
of the
naku,
complications.
Mas magastos na tuloy.
Yeah. And the patient cannot pay anymore because natapos na naubos na
ano
yung
na sa
pera nila
iba.
dun sa,
Oh my
ano,
gosh.
sa
I
previous
see.
clinic. Yeah.
Yeah.
I see.
But there are a lot, no? And I think they do have, but they sometimes front not as a clinic, but as a beauty spa
Beauty
or something
center,
like that.
aesthetic center.
Yeah, so sometimes
But
there's
I guess
no...
there are many spas now that are run by dermatologists or a member of the PDS.
They
Yeah.
do that also. And then what is done in the spa, supposing? What do you, massage,
I think
what
they have
else?
massage, they have
Facial treatment?
facial treatment, whitening procedures. You know, the Filipinos, they want to be white.
Yeah.
And they're
That's
also
nice.
allowed to use laser equipment.
Yeah.
Kasi derma, no?
Yes.
If they have
If,
special
if,
training.
that's why there are many board-certified dermatologists now who own these clinics. I think
And
you
that's
have to
better.
choose
That
one
should
that
be
is out.
safer.
Yeah, I think that it would be the trend. That's why if you refuse on participating in this kind of trend, you will be left out.
If you don't
Yeah.
participate or
Yeah, as long as you know
a
that,
practitioner.
as long as you're a board-certified dermatologist, you can have a clinic in the mall.
Okay,
Why
but it's
But-
not necessary for the doctor to always be
In the hospital.
doing the therapy.
No.
No, as long as there is a
I-
doctor.
Do you
Yeah,
have to
I-
do it personally, or you can have assistants who are non-doctors
Like
who can help you?
technicians,
Is that
therapists.
is that
There are
possible?
procedures that probably can be done by a nurse, no? Not technician. Because technician, you don't know what is the background of the technician.
Yeah, at least a nurse, mayroong
The
medical
nurse,
background.
like the procedures that dissolves the fats, no?
Okay.
This
It's
is
mostly manual
the
lang.
procedure, you can manual. It's like manual only. But for us in Makati Med, the doctor, even the attending physician should also be there around.
Yeah, while it's being done.
Okay, so
Yeah,
the
while it's
physician
being
has
done,
to be
because
around.
Some burning.
Yeah, burns,
burning.
no? They can
Burning
happen.
can happen.
Yeah. Yeah, I know that for a fact.
Yes.
Kaya,
see.
mabuting supervised.
That's right,
By
'cause,
people who know.
I get concerned because I also visit some of these centers.
Aha.
Yeah,
I
this-
noticed that
this procedure
sometimes it's
should
the
be-
therapist or the technician that is doing the consultation with the
no,
patient.
cannot be. Yeah.
Okay.
So-
So anyway, it's time to take another commercial break. So don't leave this channel. We'll be right back after a few words from our sponsors.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public
that experience, and that experience so rich it could change other people. Okay?
Like, there are other settings, right? So you hear it, you see it, and then you can smell the fireworks.
Now, put it to the game by asking you're already practicing.
The word here will again be
Something that I've learned is
words can inspire and words can destroy. Choose yours. Okay?